Good morning, folks. We're here to discuss the BLS Cpap intervention for basic providers. Make sure that you're credentialed to do this, as well as that you're familiar with your equipment. Some of the equipment regarding Cpap changes quite often. Again, just be familiar what type your agency has. Also be familiar with your protocol, when to use it and when not to use it. A couple of the big things you want to be sure of is that the patient is able to cooperate with you, that they don't have an altered mental status, that you don't suspect a pneumothorax, they're over the age of 10, and also your inclusion criteria. You want to make sure that they are in fact asthma, COPD, exacerbation COPD, emphysema. Our goal here is to provide them positive end expiratory pressure to support the lungs and to support the airway. When you have your device assembled, you want to make sure you're delivering 10 centimeters of water of PEEP. You'll hook this up, again, extend your tubing out to your oxygen source and deliver the appropriate level of oxygen. Each device is different in regards to how they deliver this system. While you're administering the mask to the patient, you want to coach them through it. You want to have them in a semi-Fowler's or Fowler's position, which generally they will be in anyway because they are in fact in respiratory distress. As you get closer to the patient, this is quite frightening for some people to deal with, so you want to almost have the blowing oxygen out in front of their face and work it in towards them as they become more and more comfortable. Because obviously you're going to get, with the bridle, you're going to get a little bit more pressure to the person's face. They're having difficulty breathing, and this may exacerbate their condition. Once the patient is able to cooperate with the procedure, move closer and closer to the mask. You want to be sure that you hook the mask up without applying a lot of pressure to the patient's face. Once you get all the strapping secured, you want to make sure that you adjust your mask for the patient's comfort. Again, you don't want to see their face getting imprinted with the mask or their skin turning blue around the mask. You want to make sure that it's nice and comfortable, and continue to coach them throughout the process. Some things you want to also watch out for is if they start to become nauseated. If they vomit, you definitely want to get this mask off as quickly as possible. Medication administration, such as if you're going to administer a nitroglycerin to them for CHF, you would just snap the mask off, pop that under there, and you don't want to interrupt CPAP unless you absolutely have to. The other thing you want to watch for is patient deterioration. If they start to exhibit signs of respiratory failure at this point with altered mental status, a significant drop in pulse oximetry, it becomes a time that you may need to move your modality from discontinuing CPAP to administering bag valve ventilations and assisting with ventilations.